a HIV positive factory worker who had worked for his company for many years. When his employer began to inquire about why he had to go for regular medical appointments, he replied honestly that it was for his HIV condition. His employer wrote to his healthcare provider asking if he was fit to continue the job. However, in spite of repeated assurances from his physician and social worker that he could continue working, his employer was terminated, even though his employer agreed that he was a good worker. Then, there was a case of a HIV positive teacher who, after telling his principal about his condition, was relieved of his teaching duties and reassigned to administrative duties. He was also told not to share his food with his colleagues, even though we know that HIV is not transmitted through food. This teacher has been trying every year to return to his teaching job, but the principal has told him, unless there's a change in his HIV status, he will not be allowed to do so. Those of you who have worked with HIV positive patients will be familiar with such stories. HIV-related stigma and discrimination in our society is a real and disturbing problem. The National Behavioral Surveillance Survey on HIV/AIDS, which Associate Professor Roy Chan had mentioned in his opening address. This was carried out by the Health Promotion Board in 2007 and found that fewer than a quarter of respondents would share a meal with the person living with HIV or buy food from a shopkeeper or hawker living with HIV. Now these results are not surprising because despite HIV being in our vocabulary for the past 27 years, there's still a lot of fear about it. Misconceptions about HIV abound. And these form the foundation for a lot of stigmatizing behaviors. People also tend to associate HIV with marginalized members of society, sex workers or drug users, for example. And therefore think that if they have nothing to do with such individuals, there's therefore no need for them to know anything about HIV. And even less reason for them to accept anyone living with HIV. We all have to work very hard to change this mindset. The theme of this conference is therefore very apt, because truly, to fight the disease, we also need to fight the stigma. Since this epidemic first began, stigma and discrimination have been major roadblocks on the path to effective responses. In many communities, HIV-infected people suffer adverse consequences of stigma and discrimination, such as social ostracism, abandonment by family and friends, and loss of jobs and property. Fear of these consequences make it less likely for people to come forward for testing, to access treatment, care and support, and to adopt HIV-preventive behaviors. In order for us to successfully control HIV, we have to create an environment where such fears are reduced to a minimum and hopefully even eradicated. We are well aware that if we continue to promote HIV testing, more and more positive people will be detected. And we have to do our utmost to help change society's mindsets so that people living with HIV will not be shunned, but treated and cared for like any other person living with a chronic illness. Earlier, I shared with you 2 examples of HIV-related discrimination in the workplace. However, I'm encouraged also by stories of employers who have shown very positive and caring attitudes towards HIV-positive people. Like in the case of a HIV patient who was doing administrative work in one company, was looking for a career change, so he applied to work in another company. That company had a policy of offering HIV tests to employees. So the patient was faced with the dilemma of whether he should tell them that he was already positive. In the end, he told them the truth, and not only was he hired, but his new job paid a higher salary than his previous job. Such employers serve as a positive role model for other employers to emulate. More than 90% of people living with HIV in Singapore are adults in the prime working age of 21 to 59 years. We have therefore identified businesses as a key target audience in our educational effort against HIV-related stigma. Workplaces can and should create a supportive environment to change mindsets and promote greater understanding of HIV/AIDS among working adults. Support from senior management and HR officers is critical for this to succeed. Members of the AIDS Business Alliance, an alliance formed between MOH, business community and others, aims to highlight this and raise support among their peers through an upcoming workplace poster campaign. It is important for employers to realize that people living with HIV can still lead a regular life and continue to be active and productive workers. The poster campaign will encourage working adults to know their HIV status and aims to create a supportive environment for not only those at risk who may be infected, but also those who already know that they are infected. We have also worked with the Singapore National Employers Federation to set guidelines on managing HIV infection at the workplaces. The guidelines advocate the provision of HIV education at the workplace, as well as provides guidance on the management of HIV-infected workers at the workplace. The Health Promotion Board has also rolled out several initiatives to address HIV stigma and increase HIV awareness in the general population. Some of you may have watched the Chinese drama serial, By My Side, currently being shown on Channel 8. This show was conceptualized to raise awareness on HIV and to dispel the myths and misconceptions surrounding this disease. We hope that with this dramatization of the struggles faced by people living with and affected by HIV, strike a chord with the viewing audience and encourage them to adopt more accepting attitudes towards people with HIV. Another project initiated by Health Promotion Board is a Positive Living Community Arts project, which is currently touring the heartlands and community places. The focus of this project is on dispelling the myths and misconceptions about HIV and about people living with HIV. To win the battle against HIV, we require not just governments and parliamentarians to play a role, but also healthcare professionals, businesses, community and religious organizations. But most importantly, we need every ordinary citizen to do his part, to learn more about HIV and know how to protect themselves. At the same time, we hope that they will open their hearts and support those who are living with HIV, so that those who may be infected will not hesitate to come forward for testing, treatment, and counseling. We all have AIDS if one of us does. That was a message of a campaign launched a few years ago by international shoe designer Kenneth Cole. That slogan was emblazoned on black and white photographs of 25 prominent AIDS activists, among them former President Nelson Mandela, Elizabeth Taylor, Richard Gere, Will Smith, and Tom Hanks. Their message was to show solidarity in the fight against HIV/AIDS and the destructive stigma associated with these devastating diseases. The fight against stigma must be at the center of any AIDS response, and I hope that with time we can change the public's mindset. And I look forward to the day when a person's HIV status does not define how he is treated by society. I congratulate the organizing committee of the 6th Singapore AIDS Conference for putting together a comprehensive and stimulating program covering a wide range of topics, and I'm sure that many valuable insights will be gained from this conference. To all of you here today who have dedicated yourselves to fighting the battle against HIV/AIDS, I salute and thank you for your tireless and inspirational efforts. Thank you for inviting me to speak at this conference, and it is now with great pleasure that I declare the 6th Singapore AIDS Conference open. Thank you.